to welcome the next report on the choices we all have for children. It's been one of my lifetime's work to keep children's issues in the forefront of public policymakers at every level of government. So thank you for being here. We have a crowd of over 350. So obviously, different venue and breakfast. Get you out. My name is Kevin Moriarty. I'm President and CEO of Methodist Healthcare Ministries, and we are the co-sponsor of the Getting the Report Out. For those of you who are going to hear me be less vitriolic in my comments, it's live stream video on YouTube, so I have to watch it. And so we have Nowcastsa here, and many of you in the room have been involved and engaged in bringing Nowcastsa to San Antonio, and I'm real pleased that they have now the people's media, a way to get issues like this out to the community. So whatever you say at those mics, it'll be on YouTube, Twitter, Facebook, and anywhere else. And so as I've advised my teenage children when they were teenagers, get that stuff off of Facebook before you go out and look for a job, because somebody's going to look it up. And mostly I've succeeded. Jennifer and I have a 15-year-old, so I don't know. I haven't been out on his Facebook site recently. Our mission at Methodist Healthcare Ministries is to serve the least served. And we do that through providing health care and social services at clinics that we own and operate, and through funds we provide to agencies throughout South Texas. And it's our mission to create access for the most vulnerable clients out there. And those of you who didn't read the Business Journal, and Scott Bailey is here, thank you, Scott, for that wonderful article on Friday. We put $72 million out into South Texas in this year to take care of services to over 750,000 patients at different places through 75 nonprofits and through our own clinics. And so we're absolutely engaged in the whole process of trying to change the outcomes for all of the people in all the communities we serve. We are the half owner of Methodist Healthcare System, and our CEO, Jamie Weslowski, and some of his staff are here. And we're proud of that ownership, because without Methodist Healthcare System's resources, we wouldn't have $72 million to put out into the community. And so it's a wonderful relationship that works for the community to be the best hospital care provider and to take those revenues and resources and turn them into community resources as well. We're proud of all our partnerships, but today it gives me great pleasure to highlight our partnership with the Center for Public Policy Priorities and the Annie E. Casey Foundation as we release the State of Texas Children 2012. I have a good friend in the front here, Dennis Campa. Dennis is the Associate Director of Policy Reform and Advocacy with the Annie E. Casey Foundation. Please stand up. Dennis is looking so much better. You know, he was bowed over, ashen, and he was limping the last time I saw him. 11 years as the Community Initiatives Director for the City of San Antonio. You know, it takes a toll on you, Dennis. I know. I did it for 20. I wished you would have stayed there, by the way, for another couple of years. Breaking in your replacement is no fun, you know. Mary Alice, it's one of your jobs, right? Keep it straight. This partnership allows us to build CPPQ's capacity to turn the data in the Kids Count book into an educational opportunity for those of us who together make up the very fabric of the safety net system our communities depend on. And as individuals who care about the kind of future we're creating for our children, anybody who's seen Scott McGowan out there knows that an educational opportunity is a morphism to morph into public policy changes. And clearly, CPQ is out there in every arena, both children's health, education, healthcare, and et cetera, to try and educate legislative leaders in our state to what's happening to the fabric of our state in healthcare and education and children's services. And it's absolutely essential that there be a counterbalance to that whole mindset that conservatism has to mean that we don't take care of the fragile, the least served, and the needy of our community, because that's not the case. The Casey Foundation has been supporting this for a long time nationally, and we're so pleased with that. The data collected by this initiative is imperative in shining a light on policies that impact our children, and the Annie E. Casey Foundation has been a model of that for many, many years. In fact, when I started setting up public policy issues for Methodist Healthcare, we used the Annie E. Casey's public policy model as one to say, this is how we can do it. Dr. Deviney is here with the Center for Public Policy. Thank you again. She is responsible for this project, and we'll talk about it in great detail very shortly. And we have a board member with the Center for Public Policy, Dazzy McClivey here. Dazzy, what a name. Dazzy, well, I could go on with that for some time. Since 2003, Methodist Ministries has underwritten this event, and we've had multiple publications with CP Cubed, including lots of capital briefings on critical to educating our legislators on issues relating to health care in our community. Some of my board members are here in the front, and I'm glad they're here, because sometimes they ask me, how does this public policy initiative work within the strategies and tactics of Methodist Healthcare? And when they come here, they see you, and they understand how we're reaching out and trying to change not only what we do, but what everybody does in the community. So thank you, Dudley and Blass and all the other board members who are here in the audience. I saw Mike Casey come in and others. Thank you for all that you do. I said that Jamie's here and Jeff Crabtree and others from Methodist System. We also have with us today our legislative leaders. And so Representative Mike Real, please stand and thank you. Well, I've watched Mike perform on many occasions, and I'm so pleased that you're out there advocating for all of these issues through our community. I don't see him that often at church. That's because I'm not there. Not that he's not there. I have another commitment that day that causes me a problem, but I take care of it. Our Representative Gallegos is here. He's coming in right now. Representative P. Gallegos, congratulations. Wow, what an audience. But you know, I from a protocol perspective, I just messed up because I started with the reps when the most powerful person in the legislature is right in front of me, Senator Leticia Vanderpute. There's no more stronger, forceful advocate for all of these issues, especially health care, than Senator Vanderpute, and she's been doing this for a lifetime. Both her lifetime and my lifetime. And I hope we both stay alive to see some positive changes come out of our state legislature. But, you know, that's the future. Senator Oresti's not here, but his office is here, and thank his staff who are here, Lorinda Robledo and Ben. So thank you for being here. Judge Sakai is here. Peter and I go back some 30 years, and without Peter and several other judges, we wouldn't have a children's court. We wouldn't have an ability to take care of our domestic violence and abuse cases in a more humane way. Victor Negron, Victor, are you here? He didn't make it. Okay. Stephanie Guerra is here with Leticia's office, Leticia Ozuna, and Dawn Larios, the staff for Representative Gutierrez. So they here? Katie Reed, I saw you earlier. Stand up. I made a mistake a couple of years ago. I thought Northeast was the largest school district, and I was in Katie's presence. And she said, oh no, Kevin, we are. And I've modified my speeches ever since and said, hey, between, it's North Side at some 90,000 students, then Northeast. And North Side is the fourth largest district in the state of Texas. And so what an amazing job we do for the children that we serve, as well as what an amazing development and growth we've had on that side of the city of San Antonio. And so that's the official welcome to all of you. We've got you all quiet. I just want to say one little word, and that is this, and I wasn't asked to do that. My job is actually over, but I can't help myself. I've had too much coffee. When you think about the report in front of you, I think we need to change a mindset in the state of Texas, and it's a very simple mindset change. We typically fund programs and we say at the end of the day, hey, isn't this great? We funded 20% of the need. Isn't this great? We fund 15% of the need. Isn't this great? 50% of the people that are eligible are going to receive services. Oh, isn't this great? We have a Medicaid formula based on an enrollment rate of 56%. I say, wouldn't it be nice if we were to go back to some of our social justice and faith principles and start talking about doing it all? Wouldn't it be nice? You know, I think we need to be greedy for children, okay? I'm a parent of 5, and at the end of the day, what I want for your child and the children of Texas is what I want for my own. I understand the necessity to provide services to kids because I've watched my children and their friends as they need services. Jen and I share on my side a disabled son who we've watched struggle throughout his life and have a difficulty getting services at all levels throughout his life. He's an adult now and he's in a lot of trouble. And because he's in a lot of trouble, I spend a lot of time trying to figure out how to get him out, as any parent does. And that throws me into contact with all of the support systems that are supposed to be out there for children and adults. And they don't exist, or they exist to such a degree that we are all in distress because of them. And so when we have a choice, I think we need to take it to the furthest reach of the ability of our entity to do the job and get it done, and do it for all. I got in a lot of trouble many years ago when I was in Dennis's position. And USA Today asked me, you know, how would we solve the problems of our city and our nation, and how would we divide the funds up? And I said, well, take daycare, for example. Instead of funding 10 and 15% of children's services for daycare and Head Start, fund every child that's eligible. And they said, well, how would you do that? I'm not a politician. I said, very simply, you know, I'd put all the money in children first. When they said, what about the elderly? I said, well, unfortunately, I'd have to prioritize, and I wouldn't fund elderly services. I couldn't get elected. Okay, I understand that. You know, but at the end of the day, it is about our future, isn't it? It is about the next generation. You know, we don't have income security if kids aren't educated and don't have good jobs. You know, we don't have a good life if kids are stuck in jails and on probation elsewhere. You know, we have to take care of our children, and we're not doing a good job of it. We're not doing it in healthcare, we're not doing it in education, but we're not doing it in a lot of places. And so, I said my piece. You know, you asked me to kind of get the crowd quiet, and I did. And now they're all yours.
Thank you.
Thank you very much.
Good morning. How's everybody doing? My name is Frances Deviney. I am the director of the Kids Count project at the Center for Public Policy Priorities, and I really appreciate everyone coming out so early this morning. Well, it's early for me. I'm a late riser, so I really appreciate everybody getting here this morning and joining me. Now, have you had your coffee? You ready? Because we have bar charts. I expect everyone to be fully caffeinated before we get going on the bar charts. So, we good to go? All right. Well, today we're going to be talking about how Texas kids are doing and how Bexar County kids are doing in particular. Now, the report you have in front of you is data that's talking about the state of Texas as a whole and how things have changed for kids over the last 10 years. Some positive changes, some negative changes, and we'll talk about those in step. The presentation I'm going to show you is Bexar County specific, so you'll have information about your community. And we'll be sharing this presentation with you on an email back to everyone who's participated today by the beginning of next week, so you have all of that data, because I know everybody likes to have data in hand. So, and I do encourage you to visit our website, stateoftexaschildren.org, where you can access this report online, share it with your friends, print it out, give it as gifts. You can also access the data for the county on your smartphone, because I know everybody wants data on the go. When have you not been at a cocktail party and somebody asks you how many children live in poverty in Bexar County? I mean, you can just whip out that phone and get it right then. So please see all the resources that we have, and I hope they're of use for you. So as you can see from our opening video, the data helps tell the story of Texas kids, right? A lot of people look at data and numbers and they're like, oh, I'm not a numbers person, I can't handle it, I don't know what to do with that. But it's really just an element of telling the bigger story. So what kind of story have we been seeing for Texas? Well, one story that was told last year was the idea of the Texas century, that Texas has really set the stage based on what's happened in the last 10 years. I like the idea of the Texas century, right? It really looks forward, and it really says that, you know, we have really built something here, and we're going to move forward, and we have plans for greatness for the rest of the century. And I like the idea of that. I like the poetry of that. And in fact, Texas was recently rated as the #1 state to do business, which is a great, great accolade. This is something that's really good. Yes, it's definitely wonderful. We were also at the same time rated as the 35th state for overall child well-being, 42nd in child poverty, 48th in teen births, and 50th in repeat teen births, and 50th in our uninsured rate. These two data points tell very different stories. And those stories were juxtaposed on the cover of the Austin American-Statesman at the beginning of last legislative session. One headline on the front page said, "The Texas century will blaze a trail for the U.S. to follow." And the idea of this was that we have weathered the economic storm better than most other states. We were still impacted, but we weathered it better than most other states, which is true, and that we're setting the stage and that other states should follow what we do. Smack next to it, on the front page, right next to it with this other headline that said, "Spartan budget plan calls for broad cuts, public school funding, financial aid, healthcare would take big hits." These tell two very different stories about what we see Texas and what we're prioritizing in Texas. So if we're going to use the data about Texas children to tell a story, let's look at what has happened in the last 10 years and ask the question, what trail have we blazed for our kids to follow? If we look at the path we've set in the last 10 years, where are our kids going to go? So let's start with the characters of our story. It's our kids. And the United States has actually added, between 2000 and 2010, we added 2 million more kids to the whole United States. The amazing part of this number is that Texas accounted for half of that growth. Texas added 1 million of those 2 million new kids. Yep. So now we're up to about 6.9 million kids in Texas. Now, a lot of that growth actually occurred in our Hispanic population. That's no different for Bexar County. Bexar County is now about 465,000 kids. The black bar is for 2000 and the white bar is for 2010. And as you can see, most of the growth occurred in our Hispanic population. Oh, actually, and just so you know, it's not that 9,000 Asian children moved to Bexar County. If you're wondering where the black bar is for Asian children, it's that the Census Bureau finally decided, we need that category. So, yeah, we've got that category there. It's actually that the population is large enough that we can actually count it. So we now have that category added as well. Now, when a lot of people see the change in the Hispanic numbers, what we see is that there's been that big growth, and a lot of people say, aha, undocumented kids, it's all those kids, right? Well, we actually know that 96% of Bexar County kids are citizens. And that other 4%, a big chunk of those kids are here legally with their parents. And I bring this point up to say that people like to have this argument, and it's kind of a straw man that they put up to be able to say, we shouldn't provide full services and we shouldn't do this and that and the other. But really, the vast, vast majority of our kids have every right to everything that we provide for American citizens, and we shouldn't even be using that argument at all. So 96% of Bexar County kids are citizens. But as our numbers grow in Texas and in Bexar County, our need grows, and our policies need to prioritize children and families, and because we want kids to be healthy, we want them to be educated adults. But in order to do that, our policies have to anticipate growth and embrace the diversity in each of our counties and across our state. So, a large part of why we have such a big population growth is our birth rate. Texas has the second highest birth rate in the country, behind only Utah. Think about it. I'm just saying. All right. So, we have a lot of babies born in Texas every year. And so, how are they entering the world? Well, there's no guarantee that you're going to enter the world healthy. What do we see from our data on infant birth? 1 of every 7 Bexar County babies is born preterm. That's before 37 weeks. That puts them at higher risk for later developmental and cognitive difficulties in life. We also know that the percentage of Bexar County babies born weighing less than 5.5 pounds, that's what we call low birth weight, is up 24% in the last decade. One good note is that births to Bexar County teens is going down. So we've actually seen a decline in the percentage of babies that are born to girls ages 13 to 19. So that's a really good thing. Caveat to that is 1 of every 4 of those babies is born to a mom who already had a baby. 1 of every 4 babies born to a teen mom who already was a mom. These are numbers that we certainly need to change because babies born to teen moms, even moms who are married and 18 and 19, still don't have as good outcomes. It's negative for the mom and it's negative for the baby in terms of their overall economic opportunity, their educational opportunity, and their health. We also see that Bexar County is doing better than the state. It's almost 40% of the state's babies are born to moms who haven't received prenatal care. It's actually only 26% in Bexar County, but that's still 1 of every 4 babies. And we know that prenatal care leads to a healthier outcome for the mom, but it also increases the likelihood that the baby will be born at a healthy weight, over 5.5 pounds. They're less likely to die before their first year. And they're also connected, they're more likely to be connected to pediatric care going forward. So what choices have we made when we're looking at the birth of our kids and the health of our moms? Well, unfortunately, we have a new state rule that says we're not going to fund services to programs, certain programs for the Women's Health Program because we don't like who they're affiliated with. We don't like who they're associated with. If they are associated with Planned Parenthood, even though they may be legally separate and financially separate, they're no longer allowed to be able to provide women's health program services. That's against the federal rules, and so now the federal government says, well, we can't give you the money anymore. So that we lose about 90% of the funding because the federal government says we're not going to fund it. Now, there is conversation about how we're going to still try to fund it as a state, but almost 40% of all of those services were provided through those affiliated providers. So even if we get the money, it's going to be a long time before we're able to get the services built back up in our communities to be able to provide not only prenatal care, but also contraception and mammograms and healthy women visits. This is on top of a decision that was made during legislative session last year where we cut by 66% our family planning program. That's $73 million. So we have to be able to focus on what we want for our kids. We've seen increases in low birth weight. We've seen too many women not getting prenatal care and good healthy visits. And so we've got to start prioritizing kids and families first, and the choices that we're making about our women's health are not putting us in that direction. So what about when kids are born, we're now into the health system? What do we know about how they're doing? Well, rich or poor, black, white, Hispanic, Asian, every child deserves the chance to be healthy and to access the health care they need. But what we know is that 1 of every 7 Bexar County kids are uninsured. And as I said earlier, Texas as a whole has the highest uninsured rate in the country. Now, ironically, I don't know ironically, but so 15th best in the country, or in the state. Bexar County's doing pretty good, 15th best, still at 17% uninsured. That says something about the state, right? If you can still be in the top 20 at 17% uninsured, that says something about our overall system in the state and how we need to do a better job of getting kids enrolled. And we have been making improvements. So what do we see? The uninsured rate has been going down, so that's really good news. Why is that happening? Well, it's not because of private health insurance. Private health insurance has also been going down. So this is kids who get their health insurance through their parents. These are jobs that provide health insurance benefits. And it's just like for families who are looking for health insurance benefits out in the regular world, businesses have to go out and shop for health insurance too. And what they're finding is that the increases in cost for providing health insurance for the employees is becoming prohibitive. They're not able to afford it anymore, and so they're cutting back on it. And so long before any discussions about health reform happened, we have seen a consistent decline over time in businesses providing health insurance to their employees. So that's not contributing to the decline in our uninsured rate. What is? We've actually seen a real increase in our public health programs. Kids who are enrolled in Medicaid and our children's health insurance program. And this is because of a lot of positive choices that we've made in recent years in getting them enrolled. So let's take a little look at that. Okay, so basically what I want you to notice about this graph is it's going up, okay? This is good. More kids enrolled is a good thing. So let's talk about what happened. In 2000, we started the Children's Health Insurance Program, and within 2 years, 34,000 kids, boom, added to the Children's Health Insurance Program, right? This is really good news. Then we said, God, that was really too successful. We can't have that. And so we've got 34,000 kids enrolled, and then in 2003 we said, well, let's make it a little harder for people to enroll. Let's make them do it every 6 months instead. Which really means, you're starting to apply probably about 5 months into your insurance. And so, boom, we lose nearly 20,000 kids in Bexar County alone in a few years on the Children's Health Insurance Program. Then in 2007, we said, okay, fine. We'll put it back to 12-month enrollment. And we see gain almost immediately back in a few years, back up to where we were in the enrollment rolls. So constant tug of war between decisions that we make, and kids are right in the middle on that. So what happened with Medicaid? Well, so what we saw in 2002, we made applying for Medicaid simpler. So we see the line starting to go up. So more kids enrolled. That's good. Make it easier for people to enroll. You don't have to have a PhD to be able to fill out the application for Medicaid. This is a good thing. It's complicated. I've looked at this thing. It's hard. So made it a little simpler to enroll. That's good. Then in between 2006 and 2008, we said, you know what, we need to save money. It's an expensive program. It is. We need to save some money, so we're going to privatize this thing. We're going to send it out. We're going to have all the eligibility run by other companies outside of. And so when the state workers heard that, they said, okay, I'm going to go get another job. So we lost all of our kind of experienced state workers on that. We privatized it out. And then you can see, even though our population was continuing to grow, flatline. We didn't add anybody to the Medicaid rolls. And that's because it's a very complicated system. It took a lot of time to train people. Kids were falling through the cracks. Applications weren't getting processed in time. We got in trouble by the feds because we weren't processing food stamp applications fast enough, which is done in the same system. And so we said, oh, that didn't work. So let's now make a commitment. And we made a choice, and Commissioner Sees made a choice and said, and we funded it through the legislature, and we said we're going to add more money in to get more employees back in the state. We're going to bring eligibility back into the state. And we improved our eligibility system, and look at the numbers. We added a lot more kids, and now we were up to, by into 2011, 180,000 kids in Bexar County on the Medicaid system. That's really great because we're able to, once kids have health insurance, they now, hopefully, have access to the health system. Unfortunately, we also made a decision during last legislative session that we were going to reduce some of the Medicaid reimbursement rates. And so when that happens, doctors say, I can't afford to see kids because it costs too much. And a lot of doctors who are really strapped. So even having Medicaid doesn't necessarily guarantee that you're going to be able to get access to a doctor. But getting them health insurance is a good start. Now we need to work on making sure they can actually get in to see a doctor. So what does it mean? Why does that matter? Well, we know that in the healthcare system of today, not of our grandparents, not even of some of our parents, but in the healthcare system we have today, you have to have insurance to have access to consistent preventative care in a medical home. It's just impossible otherwise. And when you look at whether kids, how healthy kids are, depending on whether they have insurance, what you see is that kids who are uninsured are much less likely to be considered in good health. Only 58% of kids who are uninsured are considered in good health compared to kids who have public insurance, Medicaid or CHIP. That goes up to 70%, but even still it's not great because these are families who are struggling. They have a hard time accessing care, getting to doctors. You see that private insurance, 9 out of every 10 kids who have health insurance through their families or by their families buy it independently are considered in excellent or very good health. This is why health insurance is so important. It's about the health of the child. It's not just about the kind of political process and making good points. We also know that poverty has a great impact on how healthy kids are. Kids who live in poverty are only about 60% of those kids are considered in excellent and very good health, and it goes up by stair steps along the way the wealthier the family gets. So, what does it mean when children live in poverty? Well, unfortunately, over this last decade, we've also seen a lot of disasters, both in our country and in our state. And what we know is that just like families do in a time of crisis, we come together kind of as a family, either as a country on 9/11, or as a state during the Hurricane Katrina, or as a local community during the wildfires right outside of Austin. And we come together and we really unite to kind of help lift up those people who are in crisis, right? Poverty has the same impact. It's just as devastating and it's just as powerful as a one-time disaster, but it's ongoing. But it's also something we can change. We have made that choice for our oldest population. If you look at this data, what you'll see is that back in 1970, poverty for those who are 65 and older was actually equal to what our kids' poverty is now, 1 of every 4 people. And we made a conscious choice to really invest in our Social Security system and to provide Medicare, which helps seniors be able to stay healthy, get preventative care as well. And we saw consistently over time our elderly poverty rate to continue to decline. It's now down to 9%. That's wonderful. Compare that to kids, it's clear that we have not made the same kind of commitments to reducing child poverty that we have for our oldest Americans. Now, when we look at Bexar County, the fluctuations have been smaller. It's kind of hovered around 1 of every 4 kids. But what you can see is that those fluctuations really are dramatically affected by what's going on in the economy. As unemployment increases, poverty tends to increase. As it decreases, poverty tends to decrease. And now we're seeing, because we have been on an uptick in unemployment, it's improved over the last year, but our most recent poverty data is from 2010. We're now up to 1 of every 4 kids in Bexar County living in poverty as well. The problem with this is that kids who live in poverty are at risk for long-term cognitive, emotional, educational, and health problems all the way into adulthood. So we can really prevent a lot of the problems that we have in terms of our costs, in terms of public services, if we can kind of get kids early and start improving their outcomes then. It's about 113,000 kids live in poverty in Bexar County, and so what does that actually mean? A lot of people don't get what that means, but there's actually an official cutoff number. So what that says is that for a family of 3, you have to make less than $19,090 a year to be considered officially poor. If you make $19,091, ta-da, you're not poor, okay? Magically, you are no longer poor. So, a lot of people don't get that that's a very hard line cutoff. And the reason that's important is because the programs that we have are based on the income someone makes. So whether or not you are eligible to participate in a program depends on what your family's income and what percentage of poverty they are. So it may go up to twice poverty. Families making about $38,000 a year, they can get their kids on the Children's Health Insurance Program, or it may be some percentage of that. But it's still a very important number that people need to be aware of. What this number is based on, however, is kind of antiquated. It was developed by someone just kind of academically back in the 50s. It started being implemented in the 60s. And a study came out that said people spend about 1/3 of their income on food. Sweet. Okay, so we'll figure out what it costs to feed a family of 4. And we'll kind of vary it depending on how big your family is after that. We'll multiply that by 3. Boom, we got poverty. If I went to Whole Foods every single day, it would not come close to spending, I wouldn't come close to spending 1/3 of my income on food anymore. I'm spending it on childcare and health insurance and my rent and, all those other bigger expenses. So, what's interesting about this number is that when you look at national child poverty rates, it's about a little better than Texas, but it's about 22% of kids live in poverty. If we look at trying to say, well, how effective have our poverty programs been, our anti-poverty programs? How effective are they? Do they actually do any good? Are they worth anything? We don't know based on our current measure. Well, they've come up with a new experimental measure, and lo and behold, what do we find? They actually make a difference. Providing children nutrition support through the food stamps, or SNAP is what we call it now. Supplemental Nutrition Assistance Program. Getting people in refunds, the Earned Income Tax Credit for low-income families. All of these kinds of extra services that we provide actually do improve the well-being of families and children. This is good news, right? So, what kind of choices have we made about those programs? Well, we've made some good choices and we've made some not so good choices. So, in the last decade, what we found, this is when we look at income support. It's also called TANF, Temporary Assistance for Needy Families. These are for the poorest families among us, okay? Back in 1996, we started federal welfare reform. So that's when we said we need to try to help people get to work, right? We don't want people to stay receiving assistance for their lifetime. We want to help people get to work, do job training. This is all very good idea, getting people into jobs if we have them. And what we saw was a really big decline in the number of people who were receiving assistance. And there were also strict time limits too. So you could only get assistance for a very short period of time. Then in 2003, what we said was, well, you know, we need to kind of rein this in again, and we don't like the idea of kind of providing cash assistance. And by the way, it's for families who make, a family of three that makes less than like $2,300 a year. Okay? No, around about $2,300 a year. So we said, well, we need to rein this in. So what we're going to do is we're going to start what we're going to call full family sanctions. So adults can be, if their parents can receive some assistance, and their kids can receive it, and they're kind of enrolled separately. However, if the adult makes a mistake, they don't get their application in on time, they don't kind of go seek a job in the kind of time frame that they've been offered, the child loses. The full family is sanctioned. The child loses their income support. And so what did we see? We're down to about 1% of kids in Bexar County now receive assistance, even though it's about 1 of every 4 kids live in poverty. So even though we know these programs help, we're making some choices that say we're not gonna assist. Full family sanctions in 2003. But we made other choices that have been more positive. So like I said earlier, we said, you know, we didn't make some good decisions kind of mid-decade about privatizing our eligibility system. So we said, we're going to change that. We're going to commit resources. We're going to get people back in. We're going to make sure everybody's trained. And when we did that, and thankfully this was all happening at the same time the economy downturned, so we had more people needing help, what we saw was a huge increase in the number of children receiving nutrition assistance. Now, while we wish we didn't have to provide it, the fact is, in a hard economic time, this is what helps keep families afloat. And sometimes the SNAP program and school lunches and school breakfasts are the only nutritious meals that many kids receive. So these programs are very important. Almost 1 of every 3 kids in Bexar County receives nutrition assistance through the SNAP program. Another good choice we made in the last legislative session was to expand our summer food program. That's kind of tied in with the school breakfast, school lunch program. And what you can see is all those red stars. Those are the ones where we're going to see more summer food programs opening during this summer. So that's really good. That's a really, really good choice that we made. So we know that hungry kids don't do as well in school, right? So these programs are really, really important, not only for the health of the child, but also for their mind, for their educational outcomes. Hungry kids miss more school, they're less attentive, they don't do as well on their tests. So having all these programs are really good for our education system. Let's see what's going on there. Well, what we know is that many of our kids start out behind before they even get to kindergarten. And Texas has the highest rate of kids who aren't read to regularly. 1 of every 4 preschoolers is not read to on a regular basis. That's like 3 times a week by their parents when they at home. Now, thankfully, we have pre-K. And what we've seen over the last decade is a really big increase in pre-K participation. This is due in large part to pre-K expansion grants provided by the state to say, we're going to help you open up new pre-K programs, we're going to help you expand it up if you wanted to add more kids in who weren't economically disadvantaged, so you want to bring in additional kids, we can do that. And we saw now almost half of Bexar County kids, 4-year-olds, participate in pre-K. This is wonderful news because really high-quality pre-kindergarten programs help buffer the effects of kids coming into school already behind. And actually, thanks to Representative Villarreal's office, they did some analyses that showed that when kids, economically disadvantaged kids, so kids who are poor or receiving free and reduced price lunch, those kids, when they go to pre-K, they do better on their tests, even up through 3rd grade. This is a wise investment. This is a really, really good investment. We're seeing our dollars pay off. Kids are doing better and they're passing. And what we've seen, if you look at our test scores overall, and you compare kids who are coming from poor families versus kids who are not coming from poor families, back in 2003 when we started the tax test, love it or hate it, it is a measure of how our kids are doing. There was a 20-point difference in the passage rate in our kids who were coming from poor families versus our kids who were coming from wealthier families. By 2011, that gap had closed, and now it's only an 11-point gap, so that's really good news, and everybody had improved on how they were doing on the tests. So that's really good news, both for our schools and for our economically disadvantaged kids and families, because what happens when you don't pass your tax test? Anyone? You get held back. What happens when you get held back? You drop out. That's right. And so, thankfully, we've actually been seeing our dropout rate declining. Now, this is a number that's produced by a San Antonio group called the Intercultural Development Research Association, IDRA. It's the attrition rate, and what that says is that how many kids start 9th grade and how many kids leave before 12th grade. And so what we find is that even though it's going down, and no matter how you measure it, if you look at the census or you look at TEA, it's getting better. But no matter how you measure it, we still have we have more than 1 of every 3 kids leaving before they graduate. Moving in the right direction. A lot of that is because of community efforts, communities in schools, dropout prevention programs funded by TEA. We've been pushing in the right direction, and this is definitely a direction we want to keep going. The reason we want to keep doing that is because certainly we want our kids to get a degree, and it impacts both their personal economics and the economy of the state. Dropouts make only about 36 cents for every dollar that a college graduate earns. That makes them twice as likely to live in poverty as somebody who just gets a high school degree, and 3 times as likely to live in poverty as somebody who gets a college degree. So, what does that mean? It means that their family is more likely to continue that cycle of poverty and bad outcomes that we've seen, and they're not able to give back as much to society in terms of their resources that they're providing to kind of the greater good. So, what are we doing about our investment in education, knowing all this? Well, even before last legislative session, what we knew was that Texas was 46th in per pupil spending before the cuts. Okay? We were 46th in per pupil spending, and then, in order to help balance the budget, we made a choice to cut public education funding by $5.3 billion. That's billion with a B. $4 billion of that was to the general fund, the general kind of money that each school gets to run, and another $1.3 billion of that was for grant programs. Now, you remember I just talked about how we were increasing our participation rate in pre-K and we were improving our dropout rate? Well, some of the grants that were included in those cuts were the pre-K expansion grants and our dropout prevention programs. Penny wise and pound foolish. Now, when all of our other services are not able to kind of provide the wraparound and the support that children and families need, unfortunately, one of the services that we do have to provide is child protection. This is often our service of last resort when everything else fails in the community around families. And what we found in Bexar County was that nearly 6,000 Bexar County kids were confirmed as abused or neglected in 2011. Now, we have made some good choices in the last decade. We've really made a commitment in both the legislature and in the processes and practices of the agency itself, where they invested more money in the Department of Family and Protective Services, which is good, increased the number of investigators, tried to help out with caseworkers, and we've focused on trying to keep kids in their homes. So of those kids who do receive services from Child Protective Services, 70% of them are served in their homes. That's good. It's less expensive, first off, so yay on that. But it's also, what's more important, better for the kids. If they can receive services in their home, they can receive help, their parents can receive additional assistance, it's better for everyone all around. And when we do have to remove kids, there are times when we do actually have to pull kids out of their home. It's just the safest choice for them. There's been a renewed focus on trying to place kids with their relatives. And in Bexar County, what we've seen is that that percentage going to foster care has actually declined because we've been focusing on putting kids with an aunt, a grandmother, an uncle, a cousin. Again, better for the kid, cheaper for the state. Win-win. Woo! It's great. Unfortunately, we still have to place kids in foster care. Sometimes the situation just calls for removing the child completely from that situation and placing them with another family. And we found that nearly 3,600 kids in Bexar County are living in foster care. So, last session, we had the budget crisis, and what we said was, well, we got to make cuts. We are not allowed to cut foster care. It's kind of a mandate. Any kid who comes and needs help, we're going to provide it, and we will provide them an extra home if we find one for them. So where can we cut? Well, we can cut for in-home services to save money. By cutting in-home services, you're still going to have kids coming, so what's your only option left? Or what's, one of your main options left? It's not your only option, but one of your main options left is to put kids in foster care, right? So ironically, in order to save money, we actually may end up spending more money because foster care services cost 26 times more than in-home or reunification services. Penny wise and pound foolish. And it's not as good for the kids. So, what do we see for the Texas Century for kids? What trail have we blazed for these kids? Well, we're growing rapidly. We have too many babies born too soon and too small. We have too many kids uninsured. We have too many kids in poverty. We have too many kids who are unhealthy, and too many kids dropping out. So, unfortunately, what we've seen is that Texas kids have really been in the middle of a tug of war, a philosophical tug of war about what we should be doing as a state. Where should we be investing our money? Where should we be investing our time? So the question I pose is, well, actually, before I get to that, one really quick look is, unfortunately, in that tug of war, the side that's been winning in this last legislative session was the side that said we don't want to invest. We don't want to make that commitment to kids. In addition to the cuts I told you about earlier, we have Foundation School Program, which is that big $4 billion that we talked about earlier, just the base money for going to schools. The Communities and Schools program was cut, not eliminated, but cut. They provide services for dropout prevention and support for families. Early childhood intervention, newborn health screenings, family planning services, community-based obesity prevention, community mental health services, state and community mental health hospitals, initiative to improve oral health care, children with special health care needs, provider rate cuts in Medicaid and CHIP, child abuse, neglect, and delinquency prevention, financial support for family-based services and abused kids. And that's not all. That's just a sampling. So, even our leaders are starting to come around to see that maybe this isn't the way we need to go. We have no choice unless we want to continue to try to grow our population and continue to shrink spending significantly, Strauss said. I think at some point you can't cut your way to prosperity. This is Texas House Speaker Joe Strauss. I hope y'all hold him accountable to that quote. The head of our Health and Human Services Agency and the head of our Texas Education Agency also sounded similar alarms recently. We're starting to see a sea change, but that will not maintain unless we as a group reinforce that movement and let them know that this is exactly what we want. We want a sea change. We don't want to continue with those cuts. We cannot cut our way to prosperity. So, where do we go from here? Well, when it comes to Texas's children, it's time we get back to basics. That means investing now in the things that help to give us our start, right? Like strong public education, access to doctors before we get sick, healthy food on the table. We can make smart choices to protect the health and well-being of Texas kids and help families build economic security, and it doesn't get any more basic than that. But it requires sustained and balanced investment across the child's lifespan, and it requires it happening now. But you can't expect returns on investments that you don't make. So we need to let our elected officials know that this is the direction that we want to go. But it's not just about numbers. There are people behind all these numbers, right? Sometimes you look at a number, 1.7 million, 115,000, it's just like, oh, I don't even know what that means. So let me tell you a story about how investments worked. So let's meet Manuel Luna. He is a husband and a father of 4 living here in San Antonio. The Annie E. Casey Foundation interviewed him following his experience being unemployed for almost 5 months after he lost his job in 2009. It's a time that he calls our depression. It broke me down emotionally and mentally that I couldn't provide for my family. We've never been in a situation like this before. Fortunately, he found resources in the community. Funded by the Annie E. Casey Foundation, he received services through Making Connections, which provides support for families, and also through the Casey-supported Center for Working Families, he was able to get additional work training and support that he needed. In addition, he was able to get his earned income tax credit, which provided him additional cash at tax time so he could pay his debts. He was able to get the Supplemental Nutrition Assistance Program, food stamps, right? He was able to get money to help feed his family, and he said what was great about that was not only could I get money to feed my family, but it freed up other money so I could pay my rent. Same thing for assistance he received from the food bank and energy assistance from LIHEAP, Low-Income Heating and Energy Assistance Program. So I'm happy to report that he is not here with us today because he has a job after all that. Yeah. He is a utility technician for the city's public water system, and he says that these programs really helped my family. They helped us get by in a time of crisis. And I know this is going to sound like an after-school special and like I'm making it up, but I promise you I am not. After he was able to get his financial footing back and get his new job, Manuel was president of the PTA. I mean, come on, really? He was president of the PTA. He coached his kids' soccer teams, and he and his wife both worked with the Volunteer Income Tax Assistance Program in the county. And they're now both volunteering with the Neighborhood Improvement Program. So this is an example. This is an example of how when we make investments at the local level, through nonprofit organizations like Annie E. Casey or Methodist Healthcare Ministries, and through the state, all coming together and wrapping those services around, families can be lifted up and work their way out of crisis. And Manuel said that he says, I'm working a good job, I'm spending more time with my kids, and for all the little things that I have, I am happy. So, good outcomes don't just happen. They were a result of our positive or negative choices that we make at the community level and at the state level. So we can either decide that we're going to focus on the success of our kids and building their future, or we can continue to fail them by not investing now in the things that we know will build a strong and bright future. We know that we can do really big things. And I know this picture doesn't go with this graph, but it's so cute. I had to put it in. All right. We know we can do big things. This is Texas. That's our motto. We have it tattooed on us when we're born. But it's time that we start doing the right thing for Texas kids. If we keep children and families as our #1 priority, we know we can really build a better Texas for everyone in the future. Thank you very much.